Phil owned an established business and it was really starting to grow. But he was using credit cards as an overdraft, had overdue accounts from suppliers, as well as a tax debt with the ATO. He needed to consolidate this debt and free up working capital. He saw Toowoomba's Edge Lending, who helped him replace these high-interest debts with one simple facility with lower repayments. Edge Lending Solutions, helping established businesses to grow.
Hi guys, Scott from Edge Specialist Advice Network. I hope you're all well. Hey, today I wanted to do another installment of our hybrid retirement series, but I specifically wanted to look at or broach the concern that some people would have about healthcare. So hybrid retirement is our strategy where you may need to live part-time overseas or even an extended period overseas in a cheaper jurisdiction to make your retirement or pre-retirement funds stretch a lot further, giving you potentially access to healthier food, healthier lifestyle, more freedoms, and just a better quality of life. So you can extend your quality of life out because you can afford to pay for a lot of things. Could be acupuncture, massages, health, anything like that. One of the concerns that people tell me is that, hey Scott, geez, I'm not sure about going to these cheaper countries like Mexico or Asia, Thailand, Malaysia, because my doctor, my GP, I go to see my GP once a fortnight, because that's the schedule I'm on now. And so I'm just nervous about being away from that guy. Like, how will I find a new GP? What if something happens to me? The hospital system in Asia, I'm scared of that. I've seen The Hangover. I'm not really sure. Like this is a bit fearful for me. So what I've got is it's an excellent resource which is for you guys to look at. It's a website called Numbeo, and what they do is they go on and they do lots of research. They asking people for their opinions on the healthcare system in their country or other countries they've been at. So just think of a global survey. All right. And that information, obviously, it's sifted the data correctly, or sifted as best they can, and you'll be able to get the rankings from massive surveys of people and citizens who've used these services. So this is what, because sometimes when you get things in your feed, in your inbox, the top 10 hospital systems in the world, they would be done at a corporate level, and they may have some corporate bias, effectively paid advertising. All right. Just like when you get scientific studies from certain things, you need to look at who's paying for that study. A lot of climate stuff, a lot of health stuff. Let's never forget that once upon a time that the cigarette industry used to pay doctors for reports, and those reports would say that cigarettes were healthy. They would never cross the brain-blood barrier, or would never cross through the placenta. It's all just lies, right? So, and that's okay. I understand people get paid. They want to do things. They want to get money. But when you have a survey like this, where the data becomes anonymous, then you start to cut out the bias. So I prefer these surveys much more than studies that have come through from journals. Okay, right. So let's have a look. Now, again, we're using Numbeo. So healthcare index by country 2025. So we've got all the continents across here. Okay, so we've all the regions across, and these are the rankings on the healthcare index. Taiwan, number 2. Okay, I could see that. Technology is very strong in the country. You can understand they have a very strong system. South Korea, Japan. Okay, cool. So those 3 aren't surprises. Netherlands, Denmark, Austria, not a surprise either. France, okay, I'm probably a little bit surprised by that. I didn't know whether that was going to be up in the top 10. That's okay. Here they are. So this first index we're looking at, the top is based upon care, irrelevant of cost. Just the level of care, the access to the doctors, the access to services. Okay, France, Finland, Thailand, number 9. Okay, so this isn't about cost. This is just about access to services. All right, it's just readily available, quality of care, speed of care, anything you want. Now look at that. So a lot of the hybrid retirement strategies we do is in Southeast Asia, because we do have a lot of clients that come from this region. So talking about Australia, and Thailand is really a one-flight hop. You can get to Thailand direct in 8.5 hours. So as a hybrid retirement strategy, that can be quite affordable to actually get there logistically. But then we start looking at things, we go, okay, well, the cost of living, food, access to all this stuff. Now this isn't about cost. This is just about access to quality of care. The quality of care, the availability of care, the professionalism of all the staff, doctors, nurses, specialists, chemists. So this is really good. It's good to see Thailand in the top 10. Spain, number 10. Ecuador, number 11. I'm blown away by some of these. Okay, Ecuador, Belgium, Czech Republic. Look, I was just in the Czech Republic not so long ago. We didn't go to test the hospital system, but that was interesting. So there's a lot of Europe here, a lot of Europe, and you've got Thailand thrown in there with Ecuador from Latin America. That's quite interesting, 9 and number 11. And we're coming back through Europe again. I think Europe is known to be quality of medical care is reasonably high. Luxembourg, Lithuania, Qatar, Australia, number 9, number 19. Okay, so there we are. We made the top 20. Israel number 20. We made the top 20 for the healthcare index. So quality of care. Then you got the UK, Mexico number 22. So not far away. Mexico being one of those other areas that we would talk about that is in our hybrid retirement series, especially for a lot of our Canadian and US clients. They see Mexico as a bit of a gateway through to South America or Latin America, and concerned about the hospital system, access to specialists and nursing and healthcare. So not bad. I mean, Mexico is above Singapore. Singapore at 25, right? Turkey down at 28. Malaysia at 30. Look at Canada, 31 is underneath Malaysia. All right. New Zealand, 35. So the New Zealand so on this survey, the New Zealand healthcare system must feel inaccessible, long waits, and quite small. I'm probably surprised Australia's in at 19 there, but that's where it is. Okay, let's have a look at this and see if we can do this index here. So this index is really also about cost. So bang for buck. So Taiwan, South Korea, Japan, Netherlands, Denmark, this hasn't really changed. And Thailand at number 10, Ecuador at number 11. So these top 11 here and or these top 12 is accessible hospital and healthcare. Accessible nursing, doctors, specialists, small medical centers. But this is also bang for buck on cost. So you look at these in the top area. So again, I'm going to point to Thailand because a lot of our clients have designated that in their hybrid retirement strategy, which we are assisting them with. Thailand is one of the standouts. Thailand, Vietnam, Malaysia for Southeast Asia. We like Turkey, we like Mexico as well. Panama sometimes. So there's Malaysia down number 30, which I find quite interesting. So Thailand punching above its weight. It's pushed up in here with all of these other European countries, plus these high level OECD countries. Taiwan, South Korea, Japan. Also part of the Five Eyes. Anyway, guys, look, I thought that was interesting. Numbeo is a great website. It has lots of different things you can look at. You can look at crime rates and you can compare them per city. And I am going to do one of those down the track just to show you what, the misconceptions about some of the cities and crime, and especially in Latin America or in Asia compared to the Western world. I think you might actually be quite shocked. But there's all sorts of stuff: rental yields, rental availability, housing costs, food costs, a lot of things that could really assist you if you were deciding to try and plan out your hybrid retirement strategy, where you could find your sweet spot, or where are the little bits of information and data relate to the areas that you're putting on your shortlist. All right, guys, that's enough from me. Remember, life is a family sport. Give yours an edge. See ya.
Dave and Lucy have been in business for a long time. They have a great business and a great team. After years of hard work, they wanted to increase their property portfolio with their dream home. But being self-employed, they found their bank's lending criteria very restrictive. They sought Toowoomba's Edge Lending, the business lending experts. Edge Lending thinks outside the box and were able to secure a facility for Dave and Lucy to purchase the property. Edge Lending, making business lending easier.